Uh, Now the topic is methicillin resistant Staphylococcus aureus or MRSA. Okay, so this Staphylococcus aureus bacteria is actually resistant to a particular like enzyme. Now which enzyme? This enzyme is the transpeptidase or penicillin binding protein 2. Okay, so in the structure of gram positive and gram negative we have discussed. In gram positive and gram negative, the peptidoglycan layer is more, though peptidoglycan is prominent in positive and peptidoglycan and is very small in case of gram negative. Here is the LPS, is the outer ring, and this is the inner membrane. This is the inner membrane. So in the gram positive, gram negative, in the membranes what we see, we see penicillin binding protein, here also and here also. Okay, so this penicillin binding protein consists of two components. The most important component is the transpeptidase, which is essential for transpeptidation reaction. Okay, this we know about this. Now what happens in case of a resistance develop? There is a mutation in the gene coding the transpeptidase, which leads to resistance to all the beta lactam antibiotics except the 5th generation cephalosporin, ceftaroline, carbapenems and daptomycin. Okay, so this is the overall definition of MRSA in this slide. Okay, now what are the drug of choice? So the drug of choice of MRSA is vancomycin. Vancomycin causing the red man syndrome. Other drugs, oral drugs for MRSA is rifampicin. Okay, so there are 4 uses of rifampicin and this you have to know by heart. So apart from tuberculosis, the main first line drug in TB, then the first line drug in leprosy, and there is prophylaxis of meningococcal and H. influenzae meningitis. Okay, and this is other use जो मैंने अभी just बताया कि this is the second or third choice for MRSA, also for Legionella, also for diphtheroids. Okay, now very important question, apart with these doxycycline plus rifampicin is drug of choice. This combination is like drug of choice or the first line therapy for brucellosis. This is a typical MCQ. So what are the 4 uses of rifampicin? TB में, okay, so what are in the TB? RIPE, right? मतलब rifampicin, isoniazid, pyrazinamide and ethambutol. RIP means rest in peace. कौन सा? लिवर डैमेज करेगा. ethambutol ऑप्टिक न्यूराइटिस करवाएगा. वेरी सिंपल. रिफाम्पिसिन में रेड डिस्कलरेशन होगा. ओके, नाउ other drugs for MRSA are tetracycline. This is a broad spectrum. Other drugs from tetracycline, doxycycline, अभी डिस्कस किए. Doxycycline used in brucellosis, right? Then clindamycin, linezolid, कोट्राइमोक्सिसोल, इट इज़ अ सल्फर ड्रग, कम्बिनेशन ऑफ टू, ठीक है, 5:1 रेशियो में कैसा रहता है कम्बिनेशन, ये आपको याद रखना है. नाउ वेरी इंपॉर्टेंट क्वेश्चन हेयर इज व्हाट आर the drug, what is a drug which is a topical drug which is used for MRSA, and this is a very important asked MCQ. Mupirocin. Mupirocin is the answer for a topical drug which is used for MRSA. Okay, so now this slide I think you should remember, and it's very important. IV vancomycin when we give, okay, suppose a resistance is developed against that also, okay, there is a mutation, so it is called vancomycin resistance staphylococcus aureus. Here the drug of choice is linezolid. Here the drug of choice is linezolid, but we are seeing cases of mutation of linezolid also. So when we see a mutation in the linezolid resistant staphylococcus aureus, what we give? Streptogramins. Now streptogramins is something new, right? So what are the examples of streptogramins? Okay, so streptogramins, the examples are pristina, mycin, Virginia mycin, quinopristine. Okay, these are the drugs for streptogramins, and suppose it developed resistance against streptogramins also. Now the treatment which is very fatal to the bacteria is the tigecycline, 5th generation cephalosporin, and daptomycin. Okay, now what are the 5th generation cephalosporin? It is ceftaroline and ceftabirol. Both are given IV. Okay, and what is tigecycline? Tigecycline is blocking the 30S. Okay, blocking the 30S protein, the ribosome in the protein synthesis. Okay, और इसमें बोल सकते हैं नेगेटिव अटैचमेंट tRNA from amino acid to A site. Okay, so ये हम लोग डिस्कस करेंगे प्रोटीन सिंथेसिस ब्लॉकर में. तो tigecycline is one of them and daptomycin is also there. Okay, now for superbug there is multiple resistance in the same bacteria, you know, so this bug is called a superbug. Okay, now in the Enterobacteriaceae family there is the most important E. coli and Klebsiella. Okay, the Klebsiella is developing resistance a lot. Okay, it's creating a lot of problem in our hospitals, and in the nosocomial infection it's caused the death of a patient which are admitted in the ICU, right? Now we give the extended spectrum of penicillins. The extended spectrum penicillins are the modified ones. Okay, the like acid resistance, okay, and long acting, the long acting ones which we discussed. Now the acid resistance and the long acting ones are the extended spectrum penicillin. Here even those are also, you know, like acted upon by extended spectrum beta lactamases. Okay, there are some particular bacteria which have this extended spectrum beta lactamases. Here the treatment is nothing but just add a beta lactamase inhibitor to the extended spectrum penicillin. Okay, so commonly we are using these combinations: amoxicillin plus clavulanic acid and ticarcillin with clavulanic acid, right? Ampicillin with sulbactam are used also, and piperacillin and tazobactam is the best drug for the ESBL lactamases. Okay, they are the best drug and used in the hospitals nowadays. All the government hospitals have this combination also. Now if suppose they are also resistant, suppose these are also resistant, what we do, what actually this you have to understand कि we give carbapenems. कार्बोपेनम्स में क्या आ गया? इमीपेनम, अर्टापेनम, डोरीपेनम, मेरोपेनम एंड फेरोपेनम. फेरोपेनम is the oral one. okay, in the oral one, and celestine is used with imipenem to avoid the resistance, okay, and the combination we'll discuss later. But meropenem is used a lot in our hospital settings, that we have to understand. Now these carbapenems are resistant to any beta lactamase enzyme of any type, okay. Now ESBL basically is a plasmid and coated enzyme, this you have to understand. And the C1 metallo beta lactamase, this is the Delhi superbug, once asked in a very prestigious institute. Now this Delhi superbug is actually treated by colistin, is a carbapenem resistant cases. All the carbapenem resistant cases are treated with colistin, okay. Even in pediatric, many brands like valamycin and people are using these for small babies, okay. But I say that these are also creating a lot of havoc in later part of our practice, right. It may cause even colistin resistance, we don't know, right. We'll also discuss some more things here. Let's see. Let's discuss about the vancomycin. Let's discuss about vancomycin. Vancomycin, basically you have this glycopeptide, okay, and it inhibits the enzyme transglycosylase, okay. It is a bactericidal drug, okay. It acts only on gram positive, does not act on the pseudomonas, okay, and not to be given in typhoid cases. In typhoid cases we don't use vancomycin, okay. Vancomycin IV is the drug of choice for MRSA, we have discussed just now. Oral vancomycin is used in membranous colitis. It is the Clostridium difficile infection, ठीक है. सो दिस इज स्यूडो मेम्ब्रेनस कोलाइटिस. इसमें होता क्या है, कोलोन का इन्फ्लेमेशन, उससे क्या होगा, डायरिया. और हाउ वी आर गोइंग टू ट्रीट, इट्स द ड्रग ऑफ चॉइस इज ओरल वैनकोमाइसिन. Most commonly the drug used is the third generation cephalosporin third generation. और अगर रिस्क बहुत ज़्यादा होगा देन वी यूज़ clindamycin, okay. And to treat the diarrhea, you know, we can, you know, like give probiotics electral for electrolyte disbalance, okay. We can stop diarrhea by giving, you know, loperamide, but still very cautious because it's an opioid. Apart from loperamide we can give resicadotril, but still, you know, I believe not use these antidiarrheal drugs as such. We can just control it by probiotics electral and giving the antibiotics, okay. There is a new drug for pseudomembranous colitis, is the fidaxomicin, okay. And one more thing, for pseudomembranous colitis you can go for children. These children are treated with metronidazole, as they have mild cases of diarrhea, okay. So diarrhea is also uses over here. Now vancomycin I have discussed, like it causes the red man syndrome, where there is rashes, and due to histamine release from mast cell, okay. Now other drugs from the vancomycin group, vancomycin group. There are other drugs also. So what are the names of the drugs in vancomycin group? Teicoplanin, oritavancin, telavancin, dalbavancin is the longest one. These are the longest one. Okay, and I told you fidaxomicin is used for the treatment of pseudomembranous colitis. It's a new drug, fidaxomicin. Okay. Also very important, stool transplant, or the better term we can say fecal microbiota transport is also practiced in case of pseudomembranous colitis. मतलब पूरा गट का बैक्टीरिया को चेंज कर दिए, right? There are few other things I want to discuss over here only. Daptomycin क्या है? Daptomycin या फिर एक polymyxin B. Okay, these are bactericidal drugs. These are cell membrane inhibitors. This daptomycin is nothing but very standard drug. It's used in IV, given for gram positive bacterias. Okay, and it's a drug of choice for VRSA, SRSA, LRSA. Okay, for all the fecalis. Okay, the side effects is it decreases the surfactant, so not given in pneumonia patient. Not effective. It decreases the surfactant. ठीक है, degrade करता है उसको. In polymyxin B, and there is something called polymyxin E. Okay, so polymyxin E is nothing but colistin. Polymyxin E is colistin. It is for gram negative, basically. Topical polymyxin B is used for with bacitracin in the formulation of neosporin powder. So there you can see colistin, bacitracin, and other. In IV we used in carbapenem resistant cases. Okay, these are very important. We have discussed all of these. Let's see what else we can discuss here. Here we are going to discuss about tigecycline also. It's just like tetracycline but different. Tetracycline and tigecycline both have same mechanism of action, blocking the 30S subunit of ribosome, inhibiting the protein synthesis. Okay, tetracycline has 3 groups. Okay, in the third group there is doxycycline. This is doxycycline, which you have to understand and we have to know. But tigecycline is a different group of glycylcycline. Okay, and it's all about mechanism of action is same like tetracycline, except resistance not developed. In the renal failure patient, it is safe to be used. Okay, and is a reserve drug. For nosocomial infection. Okay, so there are 3 R's. R. Okay, so now for suppose some other drugs like clindamycin. Clindamycin is drug of choice for Clostridium tetani. ठीक है. गैस गैंग्रीन. Okay. And the side effect clindamycin से क्या होता है? Increase in the Clostridium difficile. ठीक है. Used as a topical cream for acne and for protozoal infection like malaria and pneumocystis. ठीक है. Other is the linezolid. Only gram positive. ठीक है. अगर इससे डिस्टेंस हो जाएगा तो क्या आएगा? स्ट्रेप्टोग्रामिन्स. ठीक है. नाउ linezolid very important. It's sidal for strep pneumonia and static for staph aureus. ठीक है. सो MRSA में हम दे सकते हैं. VRSA में भी दे सकते हैं. ठीक है. MRSA VRSA में यूज़ कर सकते हैं. एंड साइड इफ़ेक्ट में क्या होगा? इंक्रीज इन द सेरोटोनिन causing serotonin syndrome which is also present in SSRI drugs, which are drug of choice for depression. It also side effect में इसका आएगा thrombocytopenia. So we have to monitor the platelet count. Okay. Other drug, I think final drug, cotrimoxazole has two component of sulfamethoxazole and trimethoprim in 5:1 concentration. ठीक है. Now the drug of choice, it is a bactericidal drug of choice in pneumocystis jirovecii infection, in AIDS, or like as such. Isospora nocardia, typhoid carriers, Burkholderia, Cepacia या Pseudomallei, Cyclospora like Cyclospora in UTI, in prostatitis, but not in chancroid. Here azithromycin is given. So when you learn a lot later, then you will understand what's the importance of these slides. Okay, these are like a summary. Okay, so I think most of the drugs in the resistant cases are discussed here, and this is it for now.